These pretzels are so good. Do you have jaw pain with eating too? Let's dive into it. Hey prehabbers, welcome back to the channel. Dr. Craig Lindell here, and today I'm here to show you how to manage and rehab jaw pain. I promise I can relate to this, as I literally cracked a root canal I had from grinding my teeth in grad school. I personally have a history of jaw pain and headaches, and as a student, I actually worked in a special clinic that focused on treating a lot of jaw pain and headache cases. The goal today is to show you tips and tricks I use with many patients, so let's dive into it. Let's start with the anatomy of the jaw and why this joint is so important. On a daily basis, we use the jawbone more than 2,000 times. That's a result of us talking, eating, yawning, you name it. This means that when this joint isn't healthy and we are experiencing pain, it can be detrimental to everyday tasks. Think about how often you literally use your jaw. That could hurt. The temporomandibular joint, that's a mouthful, or TMJ, as we will refer to it in this video, is the joint that connects the temporal bone, our cheekbones, and the mandibular bone, basically our jawbone. Also, there is a disc that sits in between where these two bones articulate. The TMJ is also considered an extension of the spinal column due to its connection with the neck via the skull. Hence, we're going to discuss why neck health is so important when we're talking about managing jaw pain. All right, let's jump into some of the muscles that actually help assist this joint in moving. There are 4 muscles of mastication, which means chewing and eating, which assists with chewing, grinding, and tearing up food. These 4 muscles include the temporalis, the masseter, and the lateral pterygoid and the medial pterygoid. These 4 muscles help assist the jaw with mouth opening, mouth closing, jaw protrusion outwards, jaw retrusion inwards, and lateral excursion, side-to-side movement. Now, typical mechanics when we open our mouth involve the rotation of the mandible bone posteriorly during the initial phase, and then anterior translation forward of the temporal bone as the mouth continues to open. If and when you experience some sort of overuse injury to the muscle or the joint itself, trauma, or another disease process, the normal joint mechanics can be altered, leading to a temporomandibular disorder, also known as TMD. So the joint is TMJ, but if you have an issue with it, it's TMD. When looking at what exercises can be best to address symptoms related to TMD, we actually want to look at the different causes of pain and discomfort in this area. Is the cause of the pain from the muscle? Is it the joint? Or is it the neck, the cervical spine? TMD can be a result of many different things in life that we deal with on a daily basis, including stress, poor postures for extended periods of time due to staring at our computers or our phone, or even poor sleeping habits. Stress has been a major factor from my experience with TMD, and like I said in grad school, I literally cracked my root canal from grinding my teeth. So you can actually do some simple screens that include assessing your neck range of motion, your jaw range of motion, and even self-palpation of your jaw muscles to get some insight onto your jaw pain. But if it's a serious case, we would actually suggest getting evaluated by a professional that specializes in TMD. But the reality is, in most cases, your symptoms are likely a result of a little bit of everything that was just listed. So let's discuss some exercises to help. We can't discuss exercises for TMD without discussing the work of Dr. Mariano Roccabato. I hope I said that right. He actually developed a 6x6 exercise program for TMD in which you perform 6 exercises, 6 reps per exercises, 6 times a day. And these exercises have been shown to improve symptoms related to TMD. So let's talk about exercise number 1, resting position of the TMJ. This is actually a great exercise to help individuals who deal with lots of muscle tension or difficulties opening and closing their mouth due to pain, and they can't find a comfortable resting position. An excellent cue to perform this exercise is imagine saying the letter N with your tongue resting comfortably on the roof of your mouth. After you say the letter N, then just allow your lips to touch together, and your jaw should feel relaxed in this area without your teeth touching one another. Another great cue is actually just breathing with your nose with your mouth open. You will feel the tongue actually get pulled to the roof of your mouth. Then again, I want you to just relax, let your lips touch together, and your jaw muscles here should feel relaxed. The next exercise is controlled opening. To perform this exercise, place your fingers on the joint itself, then push the tongue up to the roof of your mouth as if you're making a cluck sound. Next, open and close your mouth slowly in a controlled manner. You should feel the joint moving in a controlled manner. There shouldn't be any lateral excursion, and the amount of motion will likely be less. But you should feel a good stretch of your jaw muscles in this area. The next exercise is TMJ stabilization isometrics. Working on stability of the muscles that assist with mastication and joint health is key. Isometric work of your muscles into jaw opening and jaw lateral excursion will help develop stability of these muscles. Make sure that your jaw does not move while applying the given pressure from your hands, and just know that it doesn't require much force, so push easy. The next exercise is seated chin tuck with ideal resting position. Failing to address the cervical spine and postural muscles is a big mistake when handling neck pain. One study found that roughly 89% of patients presented with TMD also had neck pain. Working on optimal head and neck position with this exercise specifically, in addition to focusing on this position with other upper body exercises, is extremely important for managing TMD. All of these exercises demonstrated, plus more, can be found in our neck and mid-back programs to help alleviate your jaw-related pain. So again, jaw-related pain, we have to remember neck position and postural muscles. Lastly, we want to touch on the role that stress, inadequate sleep, poor diet, and lack of physical activity can play in the development of TMD, but also pain in general. Return these psychosocial aspects of care, and stress management is important to address. So focusing on management techniques, as well as diving into our 10-minute evening mobility workout via the Prehab app, are all beneficial ways to help you invest in self-care, because you're definitely worth it. All right, prehabbers, I hope you learned a few things today about managing jaw pain. Some big takeaways are: make sure that you're doing the jaw exercises we reviewed. Be mindful of your head and neck position. Be mindful if you're eating a ton of salads or if you're chewing a ton of bubble gum. Just be mindful of really working those muscles, or if you're doing a really long YouTube video like this. Last but not least, definitely check out the Prehab app. The neck and mid-back rehab and prehab programs are going to be perfect for you. In addition, we have a lot of other programs and workouts that you can try. Download the app for free on the App Store. Until next time, see ya.
Hey, did you like this video? If you did, you should definitely check out the Prehab app. It includes all of our programs, a brand new workout library, and tons more videos like the one you saw today. Check it out by clicking on this link. You get a free trial. Take control of your health today.